What are you doing, man?
I'm organizing my pens. My OCD is crazy.
Well, actually, OCD isn't some trendy thing you think you have because you like having your things in order.
Wait, what?
Well, let me educate you. OCD actually affects one's nervous system, which is your brain and spinal cord. For instance, the types of OCD are don't you think you have enough junk?
It's not junk. These are things that I need. I have to have these things. I have to get the number 2 on top.
There are behavioral and psychological symptoms such as the many compulsions, obsessions, depression, anxiety, paranoia, avoiding food, and even isolating yourself. When finding out the cause of OCD, there are no specific genes that are related to having the cause of the disorder.
Including around 100 children. The outbreak so far is centered.
One's environment can trigger OCD. For instance, infections in one's environment can trigger a compulsive OCD from fear of infection.
Still far behind.
Lifestyle has no effect on improving OCD. It is known that one's biology can be the cause of OCD due to the body's natural chemistry or brain functions. You may be thinking, oh my God, can I randomly contract OCD? But actually, the signs usually start in ages 8 to 12, and they rarely come about in ages 0 to 5. It doesn't matter what gender, ethnicity, country, or region that you live in, you can still develop OCD. Anxiety and depressive disorders are related to OCD. There are 200,000 cases of OCD in the United States per year, and it's considered a common disorder, although only 1% of adult Americans actually have OCD. You don't need a medical test, a biological test, or a genetic test to find out if you have OCD. Just simply an interview with a doctor, like so. Once again, we all have OCD symptoms, but when it begins to affect how you function or your daily life or causes lots of stress, then you may actually have OCD. As far as a prognosis goes, there's nothing consistent, but as long as you use therapy for treatment, there can be long-term relief.
Well, how can I treat my OCD?
Well, SSRIs, which are selective serotonin reuptake inhibitors, can be prescribed to you to help with the anxiety portion of OCD.
What if I don't want to take medication? What if it changes me and makes me different?
You can use cognitive behavioral therapy, which is just seeing a counselor to help confront your anxieties.
So what's the worst case scenario?
Well, if none of that works, you can have surgery, or we can shock your brain lobes so hard that you have seizures so neurotransmitters can finally get released in your brain. Well, just to make things worse, there's no sure way to help prevent OCD. But getting treatment as soon as possible is best case scenario to help you cure yourself. If you believe you have OCD, know someone who does, or want to further educate yourself, you can go to Anxiety Disorders Association of America, International OCD Foundation, Peace of Mind Foundation, or simply just see a therapist.